We are familiar now with landmarks, the important landmarks of all of these bones. We describe the femur, and we describe then the tibia, and the fibula, and the patella. So now we're able to understand the knee joint. Again, we're just going to describe in here in the lab articulating surfaces and the movements. The details of these joints is going to be discussed on the lecture. So what are the articulating surfaces? See, we have the joint, the knee joint itself consists of three joints in one. We have a joint between the lateral condyle of the femur and the lateral condyle of the tibia. That's the lateral tibiofemoral articulation. Same thing on the other side, between the medial condyle of the femur and medial condyle of the tibia. That's the medial tibiofemoral articulation. And then we have the femoropatellar articulation, which is the articulation between, kind of blurry, but between the patellar surface of the femur and the posterior surface of the patella. This and the patellar surface of the femur and the posterior surface of the patella. And we place it like that. Isn't that cute? Okay, before this, be careful. What you read, what you watch, what you see, or whatever on internet is not always right, okay? Be careful with the information that you read. I was about to edit these images that I just downloaded from internet, but I decided to keep it like that so you can see the errors in here. We're going to play I Spy to see the errors in here. In here, we'll look, the quadriceps is misspelled. The rest is okay. So in here, I included this picture just to see and to remember how the patella is actually inside or forming part of this articulation. In order to reach the patella, you will need to reach or to open the this tendon, which is the quadriceps tendon. Remember, it's the attachment of this muscle, which is the quadriceps muscle, into the base of the patella. This is the patella, so you need to open that tendon to see the patella down there. From the, and this is like a continuation from the apex of the patella to the tibial tuberosity is where we're going to find the ligament, the patellar ligament. So this is a tendon, this is a ligament. And in this picture, at least they spelled correctly quadriceps, patella, the ligament, yes, patellar ligament, tibia. This is the lateral and medial meniscus. Lateral meniscus. Okay, is this a ligament? This is a tendon of this muscle, which is part of the hamstrings, which should be the biceps femoris. And this is the lateral condyle of the femur. In here, again, another view of the articulation between the femoral condyle, the tibial condyle, so it's called a bicondylar joint, and the femoropatellar articulation. See how the patella is covered or embedded into the quadriceps tendon. Movement. Let's describe the movements now. The knee joint is actually a knee hinge joint, so allows movement in just one plane, is uniaxial. But since it has the meniscus and other structures, it allows certain or slight rotation, especially when we are to unlock the knee from the standing to the flexing position. And we can a little bit medially and lateral rotate the leg when the knee when the leg is flexed. So what are these movements? See, When you decrease, remember flexion is when you decrease the angle between the two body parts, and extension is when you increase that angle. Anatomical position, most of our joints are in extension. So this, let's start with extension. This leg, actually, the leg at the knee is extended. Anatomical position. To flex it is like you're going to try to touch with the heel of your foot, your butt. So that is flexion. Decreasing the angle between the thigh and the leg. What is the part that you're moving? The leg. You're not moving the thigh. The thigh remains in the same position. So it's flexion of the leg at the knee joint. That's if you're standing, but if you're sitting, and imagine she's doing, how do you call that movement? Wall squats. But imagine that there's a chair in there. So same thing. This leg, the left leg is extended, and this the right knee or the right leg is flexed. Just changing the positions. Look at this guy. Oh, look at this. You have in here, what position is that, or what movement? The leg is going from extension to flexion, right? He's not lifting the leg, he's flexing the legs. Please use the proper anatomical terms. But look at this. Now, the leg is extended at the knee, but what happened about the hip? See, the hip on the right hip is extended, but the thigh, the left thigh, is hyperextended. Okay, so this is extension of the thigh, and this is extension of the leg. This is hyperextension of the thigh. This is extension of the leg. The leg is extended. Doesn't matter. Look at the joint. Look at the knee. It's extended. And in here, again, the leg is extended, and just when you move around the knee joint is when you cause the movement of leg extension. I think that's, oh no, one more. Same thing in here. Okay, this guy, look, this is the left lower limb is fully extended, hip and knee joints. Look at the right upper limb. The hip joint or the thigh is flexed. Do you agree? Look at the angle. He reduced the angle between the trunk and the thigh. Now look at the leg. In this image, the leg is flexed. In this image, the leg is extended. So flexion of the leg with the hip flexed, and this is flexion of the hip with the knee extended, or vice versa. Next, but not least, the foot.